Christina. We're going to ask you a couple questions about occupational therapy today.
Okay.
First question is, why is occupational therapy important in children with early developmental delays?
Occupational therapy is important because you have development of each skill which builds on the prior skills. So you want to make sure that they have a solid foundation in the beginning to be able to build on for future skills.
Thank you.
Sure.
A couple more questions if you don't mind. What are some of the signs parents should look for when considering if their child is in need of occupational therapy?
So when a parent looks at their child, it is hard to determine what may or may not be needed. A lot of parents have the fear or the worry that they aren't developing properly. The first thing to remember is not one child is like another. So everybody has a different way of developing and a different rate at which they develop. So just because one child may be crawling and your child is at the same age and isn't crawling yet doesn't mean that there's any reason for concern. But if it starts to become more of a habit and it's across multiple areas of their development, then you may say, you know what, this would be a good time to go to the doctor and maybe see if a therapy would be a good route to start to develop skills at a little bit more of a faster rate.
So if the parent goes to the doctor and they say that their child needs therapy, what can the occupational therapist do for the child to help them along?
So in early intervention, the goal of occupational therapy is ultimately play. That is a child's job at this point in life. So the best way that an occupational therapist is able to create those activities to occur is to engage them in play and to help encourage them to do the specific tasks that you're looking for them to do. So you would expect an OT to encourage them to do those activities.
Well, thank you so much for coming today, and we really do appreciate you answering those questions. Would you mind showing us? I see you have a daughter there.
I do.
Would you mind showing us maybe some of the interventions you would do with a child her age?
So I happen to have a baby right here, and I'm able to show you some of the things. So this child is 6 months old. We'll say her name is Emily. We'll say that she is having a harder time rolling than some. So we may encourage some rolling by finding a toy that interests her. Does this toy interest you? Because you can chew on it. Does it? Wow! What about this one? And you might put it right outside of her reach, because this is going to encourage her to want to roll. So if she doesn't want to roll still, after a little bit of time of interacting and playing, you may assist. Right.
Yes.
And you definitely want to take their thoughts into consideration too. But you may assist by elevating an arm, getting them to roll on their hip, and then assume the position you're looking for. And of course, the whole time that you're doing that, you want to be making sure that they get the benefit of what they're doing. So she can now reach the toy and be happy with the transition.
Thank you so much, Christina.
You're welcome.
This is going to be very beneficial to those parents out there looking to see if their child might need occupational therapy or not.